Hey everyone, and welcome back to AI Paper Podcast. Today, we're diving into a paper that's making waves in both the AI and radiology worlds. It's called RadVLM, a multitask conversational vision language model for radiology.
Yeah, this one is really interesting. It introduces us to RadVLM, which, goes beyond your typical chest X-ray AI by adding this really cool conversational element. So think of it as an AI that can actually analyze the X-ray and then discuss its findings with you.
Exactly. So for those of you just tuning in for the quick summary, here's the gist. RadVLM is this new model that can interpret chest X-rays. But here's the really cool part. It can actually have a conversation about what it sees. So the researchers trained it on this massive data set, over 1 million image instruction pairs, covering all sorts of tasks like generating reports, spotting abnormalities, and even pinpointing locations on the X-ray itself.
And the results are, they're pretty impressive. RadVLM is outperforming those previous models we've seen, especially when it comes to anatomical grounding, which basically means it's really good at locating specific areas on the X-ray. And this whole conversational ability thing, that could really change how radiologists and other clinicians use AI in their work.
Yeah, for sure. Okay, so let's unpack this paper a bit more for those who are really interested in this. So the authors, they start by, highlighting this problem we're all familiar with, the just ever-growing volume of chest X-rays. And then you've got this shortage of radiologists, which can obviously lead to delays and even potential errors, especially when you've got non-radiologists trying to interpret these X-rays.
Yeah, absolutely. And they point out that a lot of the AI models out there right now, they mostly just focus on generating reports. But RadVLM, this is aiming to be a more collaborative tool. It wants to actually work alongside physicians to help them enhance that diagnostic process.
So how does it actually go beyond just automating the report generation?
Well, RadVLM is designed to be multi-talented, right? So think about report generation, abnormality classification, visual grounding, and even multi-turn conversations, all within one single model. And this versatility, it really stems from how it was trained. Using this diverse training data, over 1 million image instruction pairs that cover all these different tasks.
So it's like the Swiss Army knife of CXR analysis. But what I find really interesting is that they included conversational data in the training set. So does that mean RadVLM is actually learning how to talk to us?
To interact
with us?
Yeah, that's exactly it. So instead of just spitting out pre-programmed responses, it's learning to engage in this back and forth dialogue, which makes it so much more adaptable and user-friendly, for real-world situations. They actually used another language model, GPT-4o, which is known for its really advanced reasoning capabilities, to evaluate how natural RadVLM's responses are in a conversation.
Oh, wow. So one AI judging another. So did it pass the AI version of the Turing test, so to speak?
Well, let's just say it got an average score of 6.95 out of 10 from GPT-4o, which is significantly higher than other conversational models they've tested. And it scored even higher when asked, those grounded questions, the ones that require it to actually pinpoint locations on the X-ray. So that shows you that its visual understanding is really key for having a meaningful conversation.
Okay, so maybe not passing for human radiologists just yet, but definitely getting there.
Yeah.
Now let's get into the nitty-gritty of how RadVLM actually performs on these different tasks. Let's start with report generation. How does it stack up against those models that were specifically designed for report generation?
Surprisingly well, actually. Even though report generation wasn't its only focus in training, it scored highly on lexical metrics like BERT score and RUGEL, which means its reports are, structurally and linguistically similar to what a radiologist would write. But here's the key part. It also did well on clinical metrics like RadGraph F1 and GREEN. And those assess how accurately the report captures the clinically relevant information, which is obviously what really matters in medicine.
Yeah, it's not just about grammar, it's about the medical information.
Exactly. In fact, RadVLM was actually competitive with the state-of-the-art models, the ones that are just focused on report generation, and it even surpassed some of them in capturing some specific clinical details.
That's impressive. Okay, so what about abnormality classification? How good is RadVLM at actually detecting and identifying all those abnormalities in chest X-rays?
Well, they compared it to models like Chexagen and Radiolog. And RadVLM had a high macro-averaged F1 score, which means it's good at identifying a variety of abnormalities consistently, not just excelling in a few specific ones.
So it's a well-rounded performer. Were there any specific abnormalities it was really good at catching?
Well, here's where it gets even more interesting. RadVLM was particularly good at catching things like pneumothorax and edema, which are those crucial pathologies that can have serious consequences if you miss them.
Yeah, that's where the clinical impact really starts to become clear. Okay, moving on to visual grounding. I think this is where RadVLM really shines. Can you remind us what visual grounding is all about?
Yeah.
And how they tested RadVLM for this?
Yeah, so visual grounding is basically the ability to pinpoint the location of something on the X-ray image, whether it's like an anatomical structure or a specific abnormality. So it's like the model can say, hey, this spot right here is concerning.
Got it.
And RadVLM did exceptionally well. It did a really impressive 85.3% mean average precision and anatomical grounding, which was way better than other models. So it can accurately locate and identify specific anatomical structures on a chest X-ray.
Wow, 85.3%. That's really high.
It is, and the researchers think that's partly because they use the chest imaging dataset, which provides these really detailed annotations of the anatomical regions in chest X-rays. So by training on that, RadVLM developed this deep understanding of how different anatomical structures are related to each other within the chest.
So like you learned the geography of the chest.
You got it. And that means it can answer questions like, where's the left lung? Or show me the aortic arch with, pinpoint accuracy.
Wow.
And this is particularly useful in conversations where a physician might ask RadVLM to explain a specific finding in more detail.
Okay, so this all sounds incredible, but before we get too carried away, we got to talk about the multitask training approach.
Yeah.
So the authors did some studies to see if training RadVLM on all these tasks at the same time was really beneficial. What did they find?
Well, they found that generally RadVLM did better than those models that were just trained on a single task, especially for the tasks with smaller data sets. So that suggests that by learning all these things at the same time, RadVLM gained a much more holistic understanding of chest X-rays. And that led to better performance across the board.
So it wasn't just a case of like throwing everything at the wall and seeing what sticks. This multitask training approach actually made for a much better model. That's really exciting. But what does this all mean in the big picture? How could RadVLM actually change radiology? Well, that's something we'll dig into more deeply in the next part of our deep dive.
I think the implications of this research are pretty huge. It's not just like a small improvement. RadVLM could actually change how we think about AI in radiology.
Okay, I'm listening. So what kind of future are we looking at here?
Imagine AI assistants working right alongside radiologists, giving them insights in real time, answering their questions, even flagging potential issues that might be easy to miss.
So basically every radiologist's dream.
Exactly. And it's not just about making their jobs easier, it could actually make diagnoses more accurate and consistent, especially for those really tough cases.
That makes sense. The paper also talks about how important it is to have reproducible and standardized evaluation in AI research, especially in medicine. How does RadVLM address that?
Well, the authors were really careful about this. They put in a lot of effort to re-implement and evaluate other models, using the exact same conditions and data sets as RadVLM.
So a level playing field.
Exactly, which is super important for building trust in these AI diagnostic tools.
Absolutely. Okay, let's zoom out for a second. RadVLM is a great example of how vision language models, or VLMs, are being used for all sorts of things. What do you think about the future of VLMs in medicine?
I think it's a really exciting area. Because traditionally, you'd need different models for report generation, classification, object detection, and so on. But VLMs like RadVLM can handle all of those within one framework.
Right, it's like they're multi-talented.
Exactly. And we're really just getting started with what they can do. It's almost like they're starting to understand the world better, even the world of medical images.
So are we saying VLMs like RadVLM will replace radiologists?
No, not at all. At least not anytime soon.
Okay, good to know. But it does make you wonder how the role of radiologists might change.
Well, the authors actually have this interesting idea. They envision a kind of two-tiered system for AI in radiology.
A two-tiered system, I'm curious.
So first, you'd have highly specialized AI tools. These would be focused on generating really detailed and accurate reports, and they'd be designed for experienced radiologists.
So like the AI specialists?
Exactly. And then you'd have more adaptable conversational agents like RadVLM. These would be easier to use and accessible to more clinicians, even those who aren't radiology specialists.
Got it. So AI tools for both specialists and generalists.
Precisely. The goal is to make this specialized knowledge more widely available.
Yeah, it's about supporting human expertise, not replacing it.
Right. Imagine a general practitioner or even medical student being able to consult with an AI about a chest X-ray, getting clear explanations and guidance right away.
That could really change medical education.
Absolutely. It's all about using both human and artificial intelligence to give patients the best care possible.
Okay, so this paper is about chest X-rays. But I can see this being used for other types of medical imaging too.
Oh, definitely. CT scans, MRIs, ultrasounds. The possibilities are really exciting. Think about it. AI helping to interpret pretty much any medical image, that could be huge for so many different specialties.
It's a really inspiring vision. But we have to remember that this is all still pretty new. What are some of the challenges and next steps for this research?
I think one of the biggest challenges is making sure these AI models are robust and reliable, in real-world clinical settings.
Right, they have to be able to handle all the complexity of actual patient cases.
Exactly. Another important thing is to develop ethical guidelines for AI in healthcare.
Absolutely. We have to make sure these powerful tools are being used responsibly and fairly.
Right. And as AI keeps advancing, we need to keep having open discussions about its ethical implications for medicine.
That leads to another big consideration.
Yeah.
Transparency and explainability.
Yes. It's not enough for these models to just give answers. We need to understand how they got to those answers.
So it can't just be a black box.
Exactly. And as these models become more complex, explainability is going to be even more important.
Right, so AI isn't just giving us results. It's a partner that can actually explain its reasoning and give us valuable insights.
Exactly.
Yeah.
And that's the future I'm really excited about.
Well said. This has been a great discussion. But I think that wraps up this segment of our deep dive.
Let's try to picture how this might actually work,
Yeah.
in a real clinical setting.
Okay, yeah. Let's make this real for our listeners.
All right, so picture this. You're in a busy emergency room. A physician is looking at a chest x-ray for a patient who's having trouble breathing.
Okay. Happens all the time in the ER.
Right, exactly. So this physician, they think it might be pneumonia, but they want to be sure. Maybe a second opinion or just like a quick confirmation.
They turn to RadVLM.
Yeah,
Right.
exactly. And instead of just getting a pre-written report, they can actually talk to RadVLM about the x-ray.
That's where the conversational part comes in.
Exactly. So the physician could ask something like, RadVLM, I'm seeing some opacities in the left lower lobe. What do you think?
And what happens then? Does RadVLM just say like yes or no?
No. Remember, RadVLM can do that visual grounding thing. So it might say something like, yes, I also see opacities in the region defined by these coordinates, insert coordinates here, which could mean pneumonia.
Wow. So it's not just agreeing or disagreeing, it's actually pointing to the evidence on the x-ray.
Exactly. And the conversation could keep going from there. The physician might ask, is there any pleural effusion? Or what's the size and shape of the heart?
And RadVLM would just answer.
Right, giving real-time responses, pointing out details on the x-ray.
It's like having a radiology expert right there in the ER.
Yeah, available 24/7.
That could really change things for how radiologists and other doctors diagnose and treat patients.
Absolutely. And even though this paper focused on chest x-rays, we could see this being used for all sorts of medical imaging.
Yeah, that's what's so exciting.
Right.
The possibilities are huge.
So the authors had this interesting thought. They think there could be a two-tiered AI system for radiology in the future.
Yeah, you mentioned that before.
Yeah. So on one level, you'd have those highly specialized AI models, the ones that are really good at making reports. And those would be for the expert radiologists.
The AI powerhouses.
Exactly. And then on the other level, you'd have those adaptable conversational agents, like RadVLM, the ones that are easier to use for a wider range of clinicians.
So AI for both specialists and generalists.
Right. The specialized models would be for those really complex cases, and the conversational agents would be there to guide and support other medical professionals.
I like it. AI for everyone.
Exactly. It's about giving everyone access to these AI insights so all clinicians can make better decisions.
So where do we go from here? What's the future of RadVLM and these conversational AIs?
I think we're just scratching the surface. As we get more data and these models get even better, conversational AI is going to be really important in healthcare.
Imagine AI being a part of everything, from diagnosis to treatment.
It's an exciting time. I can't wait to see what happens next.
Me too. Well, this has been a great deep dive into RadVLM and a glimpse into the future of AI in radiology.
I hope everyone listening found it as interesting as we did.
And if you're as excited about all this as we are, definitely check out the paper. There's a lot to explore and think about.
The future of AI in medicine is changing fast. We all need to stay informed and involved.
Well said. Thanks for joining us, everyone. Until next time, keep exploring and stay curious.
The future is collaborative, it's conversational, and it's full of possibilities.